So I'm going to tell you a little bit about GARM, which is the Global Alliance of Regenerative Medicine. And GARM not only takes the most innovative treatments and regenerative medicine therapies from development, but also deploys these therapies and delivers those to patients who can benefit from them most. For over 10 years, GARM has been taking these innovative treatments and therapies and treating patients. And we're located in the Western Caribbean on the island of Roatan. And we're opening up our new facility later this month in the Bahamas. And it's been based on a medical tourism model combined with a CRO, contract research organization model, where we are able to accelerate the innovation process and expedite the delivery of these innovative and regenerative medicine therapies to patients. The GARM Clinic was founded by a world-renowned orthopedic surgeon in 2014 and started off as a retirement project, which snowballed and evolved very quickly for him and the team. And he wanted to ensure that the best therapies and the most personalized approach to treating patients could efficiently be delivered to patients and do what he had found had worked best within his practice in the US and take that to offshore without some of the restrictions here within the US. Now, a little bit about Dr. Terry, who is the founder of the GARM Clinic. He was the head physician for the US Olympic team. He had a very long and extensive career in sports medicine and really as a trailblazer within the orthopedic space. He also is incredibly well published, still completes research, and is currently writing a book as well. In addition to Dr. Terry, Heather Terry is the CEO of the GARM Clinic, and she comes from an extensive career within the pharma med device space before founding the GARM Clinic with Dr. Terry. I have always worked within the life science biotech industry since the late 90s. My background started off as a molecular biologist, working on the Human Genome Project, and then moving into the gene and cell therapy space over the last 10 or 15 years. And then Grafton is our Chief Strategy Officer and has been an integral part of our expansion within the Bahamas. A few testimonials from some of our patients. So we have some Olympic gold medalists. We treat a variety of professional athletes, executives. We've been highlighted on the Joe Rogan podcast, and we have continuing an increase in a number of professional athletes and patients that we treat within GARM. We also are the exclusive provider for the Vault Cares Network. We're the exclusive offshore provider for them, which has really been an exciting development for our network and created a significant business opportunity for us to increase the volume of patients that we're treating and deliver care. So, first, let's take a step back. What is regenerative medicine? So it applies engineering and life science principles to heal, replace damaged tissue, promote organ renewal, restore lost functions, and really take a preventative approach to one's health. The regenerative medicine therapies that we deploy and also take through our research programs are gene-based medicines, genome editing-based therapies, cell therapies, and tissue engineering products. And so our mission is to develop GARM as the global hub of regenerative medicine, enhancing health, wellness, longevity, and the quality of life for patients with chronic diseases and acute injuries by providing safe, effective, personalized, and donor-based stem cell and carefully curated gene therapies. Now, we touched on this earlier within the panel, but the real challenge within the biotech and pharma industry is this process from development to approval, FDA approval. And most companies, particularly now, given these biotech drought that we're all experiencing in the life science and biotech industry, is most companies don't survive this process. And they don't survive it not because they don't have a good solution or a good therapy, but because it's a very extensive process, time-consuming process, and a very expensive process. It typically will take 10 to 12 years for a novel molecule or new therapy to get approved by the FDA. It also takes hundreds of millions, typically, or if not several $billion to receive approval. Now, what we're trying to provide and what we are providing for some of the earlier stage companies that we've partnered with is a solution to this challenge. We can accelerate the approval process and revenue generation opportunity for these young companies through commercializing these technologies at an earlier stage, develop proof of concept data, win fast or lose fast with these technologies. But first and foremost is safety. So we have a full clinical study pathway where we have an IRB review process before we'll even adopt any new technology within our contract research organization ecosystem. And then we perform our clinical studies and clinical trials. And then once a therapy is deemed safe, it transitions over to our deployment infrastructure, where we offer these therapies for patients. We also have a fractional usage model. I'll touch on this in a moment, and it's all within quite a nice setting, both in Roatan as well in Bahamas on Paradise Island. So the upper component of this slide is our contract research organization capabilities. So we have preclinical study guidance. We have an IRB, which either approves or denies any new technology that comes through our ecosystem. We have the capability for crowdsourced patient recruitment. And then we have a relationship with an entity that either approves or requests that companies go back to the drawing board to generate more data before we move to the deployment infrastructure. And that team is led by a former FDA deputy director, and he has a very experienced team that reviews any new technology that comes through this ecosystem. And then on the deployment infrastructure, we have manufacturing capabilities, which we're expanding currently. We have extensive marketing capabilities to identify the right patients for specific therapies who could benefit from them most. And then we also have a model in which we partner with physicians globally who want to take advantage of our therapy portfolio. And before any new physician is able to utilize us as a resource, they go through a credentialing process and background check. Now, each of our facilities, there's a number of direct flights from the global hubs, primarily in the US for Roatan. You can get to Nassau, Bahamas from the UK fairly easily. From here in South Florida, it's a 30-minute flight. You actually spend more time on the runway than actually in the air when you're traveling to Nassau. So the proximity to the US is an exciting development for us, where we're providing a much more seamless and expedited deployment of our therapies to patients within the US. Now, the ecosystem of physicians that we've partnered with, we have developed what we call We Treat. It's like we work for physicians, where physicians can take advantage of our infrastructure, either in Roatan or here in the Bahamas. And all they have to do is show up following that credentialing process, and then they can either treat their own patients or they can treat the patients that we recruit through our marketing efforts. And this has become a very attractive offering for these physicians, in that it provides them an opportunity to provide the best care for their patients, and as well as access to our therapy portfolio, which is not available in most cases anywhere else in the world. Now, the types of therapies that we're deploying are a variety of gene and cell-based therapies. We also have wellness and preventative care. We do partner with some advanced companies that have therapies for advanced stage diseases, which I'll speak to in a moment. But we really don't take a one-size-fits-all approach to medicine, and we provide the best care, an individualized and personalized approach to the patients that we treat at the GARM clinic. As I mentioned earlier, Dr. Terry's background is as a pioneer in the orthopedic space, and that is a large part of our model and the types of patients and treatments that we deploy within the GARM clinic. Our approach and our goal is to avoid surgery if and when possible, and that's where our novel therapy portfolio in regards to gene and cell therapies comes into play. We also have partnered with some early stage biotech and biopharma companies that have some novel cancer treatments. We're actually running some clinical trials as we speak, and we should be starting early next year some additional clinical trials for these cancer therapies. And these will provide an option for these patients who otherwise would have no other option. And then we also have a growing portfolio of therapies for neurodegenerative diseases as well. This is a quick list of our therapies that we're currently offering on an ongoing basis. Happy to speak to these one-on-one with you all later. Not going to read through everything. And then we have an exciting pipeline of therapies, again, in the preventative and longevity space, the neurodegenerative space, and then orthopedic, oncology, and then metabolic and cardiovascular disease and disorders.
What's the rule of law in this island? Are you on one island or in more than one location?
We're in more than one location.
Okay,
so
what rule of law do you guys follow?
So we are in Honduras, which is where Roatan is located. We're under the Honduran law, so their Ministry of Health. And then in the Bahamas, we are governed by the Ministry of Health in the Bahamas. And
are there treatments available there that are not FDA approved? Or?
Yeah, yes, yeah. But it goes through an approval process there. And one of the one of the driving factors for our move to the Bahamas not only was proximity, but they recently passed a regenerative medicine bill, a longevity of regenerative medicine bill, looking to attract entities like ours, and we should be one of the first entities that's going to market there.
And you do like the blood transfusion as well, or?
We can, but most of our therapies are cell-based, gene therapies, and then we have some upcoming therapies that we'll be able to speak to soon. Yeah.
Can you just go back 2 slides just really quick?
Yes.
Yes. One more. There you go.
Sure. I'm happy to share this
with you. The whole regenerative medicine space is very intriguing. There's a guy out of Texas who's going to Mexico every 2 weeks to get blood transfusions from 18-year-olds and stuff like that. So,
yes. Yeah.
Right.
Yeah.
I mean, He's
Yeah.
another family office guy.
Yep,
If you're going, Marty, we'll go with you.
I'm pretty good.
This is all private pay, right? No,
Yes.
no insurance.
no
covers
insurance,
anything.
yeah.
And what's the stuff cost in range?
Yeah, so, there's a variety of therapies. We have, essentially well, I can skip to this slide. So we have our ultimate longevity package, which is right around the 100,000 for this bundle of therapies. And then, individually, it's less for the individual therapies, but the combined price for that is about 100K. And so, we have a follistatin gene therapy, which has been growing in excitement and interest within the longevity space. And we actually were a collaborator on a paper that was recently released where we showed, or they showed increased muscle mass, increase in bone density, a decrease in epigenetic age, decrease in body fat, increase in telomere length, which is one of the biomarkers of aging, and then improvement in quality of life. We also offer Muse cells as well as one of our stem cell therapies within our portfolio. And that's also a component of our ultimate longevity package that I mentioned a moment ago, which includes the follistatin gene therapy. Now, one of the reasons we adopted the follistatin gene therapy is it is reversible. It isn't permanent. It does not get into the chromosomal DNA. So, some of the other gene therapies that were mentioned earlier that use a viral vector, those are more permanent and, are great for rare diseases and other applications, but safety is paramount to everything we do. And we don't want to adopt any technology that has any type of safety profile. And that's was one of the drivers of, aside from all of the benefits of follistatin in regards to why we adopted that type of gene therapy and this approach to bringing new therapies online.
And also you talked about platelet treatment.
Yes.
And what applications? Do you have multiple applications or just like for your knees or
Multiple.
skeletal?
Yeah, multiple applications. Yeah, I mean, we do intrathecal injections, we do knees, shoulders, a variety of joints.
Is that an injection or is it oral?
Injection.
You guys haven't done an optimization.
So we aren't doing any AAVs.
Okay.
Yeah.
Where do you make most of your money? Like really complicated stuff or I saw cool stuff. Got the Miami stuff and that's really great.
Yeah, so I think if we were to zoom out and look at our business model, say about 30% are from our CRO services currently, contract research or operating as a contract research organization, and then about 60% in regards to the clinic and the therapies that we offer. And then to your question specifically, it's more these novel therapies, so these gene therapies or the ortho procedures that we provide.
Great.
Sure.
So does a person like hear about you and go and get tested and the whole rigmarole fly out there, or have they already gotten some type of prognosis or live longer, however basic it may be, and then books a trip? Or like, how does it?
Yeah, so it's typically someone either. So the way the business has been built to date has been word of mouth. And so it's been through our network of physicians and our, just some people who know of Dr. Terry and his reputation. And the typical process would be a telehealth consult is booked with him or one of our partner physicians. And it would be, let's say you have a knee issue. Let's start there. And you would send your images to our clinic. You would get on a phone call with your physician here and one of our physicians there. and they would determine if you're actually a good fit. We don't just accept everyone and anybody. There's a vetting process for the gene therapies, for everything. And then if it seems like it's a good fit, then we have a patient liaison who actually works with the physician and the patient and assists with booking travel, including flights, hotels, getting from the airport once you're down there to the facility, and then getting back home.
Your alliances of concierge doctor groups?
Yes, and that's actually increasing quite a bit. So that's we're actually in a fundraising round now, and if you go to our website, it's a little bit out of date. We're in the process of totally revamping our website and everything, so improving our branding so that as we're going to market in the Bahamas, we have a fresh brand image that's reflective of the business and our full capabilities.
I mean, you've got MDVIP right here in Boca.
Yep.
Which is the largest concierge doctor network in the country.
Yes.
I don't know if you work with them.
We've started discussions with them, yes, and then we have physicians around Europe, in Asia, and then all around the U.S. We're part of some groups, and then we have the Bulk Cares Network, and so we're their exclusive offshore provider of medical care for regenerative medicine as well. And that's a cash self-pay insurance network.
Right, and do you guys do anything in the like scanning space as well, like full body scan and things like that?
Yeah, so it's an area we're exploring. Our clinic here or in the Bahamas actually has imaging capabilities, but you may be referring to, for example, a Prenuvo scan where you can actually do preventative screening, and it's not part of our standard offering, but we do have patients send images to us, in advance of any type of treatment.
Is there any AI aspect? I have to ask this for good reason. Is there any AI aspect to what you guys did?
Yeah. Yeah.
There isn't, why not?
Yeah. Well, there's quick. Yeah. No, we are exploring how we can best incorporate AI into the business model, but some of them are in, I think the standard top of mind application within drug discovery is for identifying novel targets, but we're also looking at how we can utilize AI for our marketing efforts. We are actually working on the development of a platform to monitor health metrics, a variety of health metrics. We don't want to take a shot in the dark approach to how we're treating patients and how we think the treatment is an individual may be responding to a treatment, because it's a very individualized process. So we're screening a variety of biomarkers, inflammatory biomarkers. It depends on the type of therapy and treatment, but that's where AI comes into play, because we can monitor trends over time on how an individual is responding, not responding to a specific therapy, and when they may benefit from an additional therapy as well.
I'm under the, we've had this discussion many times in our group, which is that healthcare is on this pathway to bifurcation, where in the future, almost, all care, like specialized care will also be concierge. Like you'll be able to have an oncologist you contract out and will care of you all year long. If you've got an episode of cancer, or, you can have a cardiologist who you contract out with at a premium. Right, and this is just another part of it.
Right, exactly. But I even before AI became a buzzword, I was working for another company where we were applying AI to interpreting genomics and medical imaging data, and it's a very powerful tool in a physician's tool belt if used appropriately, and then also obviously a very powerful tool within the drug discovery process as well, in identifying novel targets. And there's a number of companies that are doing some very powerful things in the space. And so, we're a part of that ecosystem, the broader ecosystem. But yes, short answer, we're looking how and where we can best apply AI within our business.
But compliant,
Yes, yes.
okay, DNA blood tests, is that third party or on site?
Third party right now, currently.
And then the data is on premise or on the cloud?
On premise.
Okay.
Yeah.
That's great. So you guys, obviously, security is very important.
Yeah, 100%. Yes.
Come back.
Okay. Great. So again, we have a number of stem cell offerings. We have autologous stem cells. We have MSCs. We have Muse cells, as I mentioned earlier, and then exosomes. And we deploy the best therapies and cell types to meet the specific individual's needs. And then our new facility is in Paradise Island, and it's walking distance from Atlantis. It's on a super yacht marina, and you can see this red arrow here. This is where our new facility is, and then we're raising funds for the build out of our new facility, which will be at the end of the building here. And then you can see Atlantis here in the background, just to get an idea of where we are in relation to there. Now, the business model and how we're generating revenue, as I mentioned, we offer CRO services for early stage biotech, biopharma companies. We also, some of the companies that we're partnered with don't have the funds to conduct clinical trials. In that case, we'll take an equity position in those early stage companies if we feel like it's a good investment for us, because we still have to utilize our own resources to run those clinical trials. Our We Treat clinic, where we have physicians who are utilizing our infrastructure, and we're generating revenue through that stream, and then commercializing new and existing therapies through our ecosystem. So we're raising $2.8 million for the build out of our new facility, for this rebrand that we're in the process of completing, where for sales and marketing, and for our medical and CRO expansion. We have a number of companies that have come to us that want to utilize our infrastructure to run their clinical trials, but we need the infrastructure to support in taking these companies through the approval process. And so that is why we are raising the funds for to build out this ecosystem. So we have a turnkey solution both for early stage companies as well as physicians who want to gain access to our therapy portfolio, and really provide the best care to patients who can benefit from them most. And that's it. Any questions?
Right, so on this, can you go back to the raise page? How much have you raised so far, and you're looking, and what's the structure, like, how does the investor get their money back? What's the timetable?
So we're already generating revenue, and it's about a 3 to 5 year investment.
What's the projected IRR? Are you as a person investing in equity?
Yes.
Okay.
So this represents 10% equity in GARM.
And that's both locations.
Yes.
And did we get a cash flow statement of how the existing business is doing right now?
Yes, I can provide that.
But it's not here.
No.
Is there a profit?
Yes.
Okay.
Everything has been
What kind
self-funded.
of margins are, it's a bootstrap business?
Yeah. And so that's why we're raising the funds. I mean, we can self-fund, but we want to expedite the expansion into our Bahamas location. And we could bootstrap it and slow down the expansion process. But we have been met by significant demand from companies and from patients, and we're actually starting a marketing campaign in the near future, we're gonna be, I know we've already begun seeing an influx of patients as well.
Was there a slide in here on demographic analysis or no?
There wasn't, but I can provide that as well. We have a pretty thorough breakdown of our ideal customer profiles.
Right,
And
so,
demographic, yeah.
you know, for an investor group, what you wanna see is that slide of,
Yep,
you know, who are the consumers of the product?
yeah,
How big is that market? Who are your competitors in the space?
Yep.
You know, and is RFK Junior gonna help you? Like, I mean, right, I mean, like, if you're retired, like in Germany, don't you get like special benefits? You get to go to a spa once a year or something?
All the time.
No, I'm serious.
I'm serious.
Yeah, when I lived in Switzerland, it was a
The
thing.
Swiss is the same.
mhm,
Yeah, you get all kinds of, 55 years old, you get like incredible retirement benefits, right?
right.
So, and I'm not sure if that's part of the European businesses you guys have.
It's some of it. I mean, most of it's high net worth individuals who are flying in from all over the world to get access to the therapy portfolio.
Did you get a demographic of what's the current market size of healthcare tourism in there?
I don't believe it's in this deck, but we are about 0.04%. Where we're projected to be in 2028 is 0.04% of the wellness tourism market at that same year. So, yeah, we have,
I'm just saying,
Yeah.
we'll talk about improving this deck. Because I think there's a lot of arguments that we get made to us all the time that you didn't make, but I mean, it's still compelling.
yeah, I decreased the slide deck in the interest of time and to get the business model across.
So I'm just trying to understand, why does the CRO business matter to us?
So one of our unique value props is the unique therapy portfolio that we have access to.
So you're able to evaluate the therapy that you're.
Yes, so therefore we have therapies that aren't available anywhere else in the world in some cases, because we've run the clinical trials at our site, are able to deploy them before they receive approval in other jurisdictions. So some companies decide to commercialize their technology only offshore, only with us, and then we operate as a distributor to other locations, or they run clinical trials and then in parallel are running trials or utilizing the data generated within our lab for FDA approval. So they can get a jump start on generating revenue before therapy is approved here in the US.
You don't have any patents, right?
No,
So when you said you have unique therapies, I mean, they're only unique because somebody copies them.
well, the companies, we don't personally have the patents, but the companies that have developed the therapies, in most cases, have patents on the technology.
Are you establishing an exclusivity with them?
Yes, either regional or global, yes.
You guys plan on trying to obtain patents at any point?
Yeah, it's,
Licensing it?
yes.
So there's a lot here, what's the final sort of line on that, like, or the founder, what's his goal, dream? There's a lot of verticals here.
Yeah, I mean, it's to get the best therapies to the patients who can benefit from the most, from a medical perspective, but from a business perspective, it's to scale the business over the next 5 years.
When you talked about, like you had like a package of like $100,000,
Yes,
are you pre-selling any like, let's say like 50 slots, VIP slots for the Bahamas to raise,
Yes.
to $1 million?
yeah, that's actually a promo, yes. Yeah, so
Very
yeah, so that's yeah. But yeah, there's a lot within this business model, and I tried to keep it as concise as possible to hit the high notes, but I'm happy to drill into any specific point later this evening.
Fascinating stuff, this is great.